Hello. My name is Jones, and today we are going to discuss a range of issues on how to answer medical questions. Okay, so most of the time when you are tackling medical questions, the first part, or part A, is to define the condition at hand. Okay, so in answering the question of defining a disease, there are certain elements that you as a student or a scholar, you need to put in mind. Okay, so you might be told to define, for instance, a fracture, or you might be told to define glomerulonephritis, if that is the condition at hand. You might be told to define cerebrovascular accident, if that is the condition at hand. You may also be told to define diabetes mellitus or colostomy, asthma, or any other condition. Then other questions will follow after that. So when answering such questions, it's important that you know that there are certain pillars within the definition, or there are certain elements that you need to be returned for each and every definition. So in general, you need to understand that when you're defining a condition, you need to know whether that condition is acute or chronic, because this will help you to score a mark. If, let's say, you are defining diabetes mellitus, it is important to note within your definition that it is a chronic condition. Then it is also important, as the next in line, to explain the cause or etiology of the disease. If the example here given is diabetes mellitus, then we are going to say a metabolic disorder of carbohydrates and other nutrients. Okay, so it is a metabolic disorder because it does not only affect carbohydrates, other nutrients are also affected. So you need to talk about the cause within your definition. Okay, then after that, you also need to state or to try to mention the system that is involved. Okay, so these diseases affect one system more than the other. So even in the categorization of these diseases, you might find that when you talk over the COVID-19, it is more classified as a respiratory tract infection, though it affects other systems. Okay, so of which it would not be surprising that afterwards they do not just look at it as a respiratory infection, but also an infection that is causing blood disorders and other disorders that follows it. So it is important to recognize the system that is most affected when you are defining a condition. Alright, so then at the end of it, it is also important that you also explain the characteristic signs and symptoms of the condition. This is very, very important to be the last part of your definition. So what have I just mentioned here? What I've mentioned is that when you are defining a disease, it is important to quote whether it is an acute or chronic. When you're talking of an acute infection, that is an infection that can affect you within a short period of time, and within months, weeks, or in less than 6 months, that disease disappears. But when you're talking of a chronic infection, you're looking at a condition that is going to affect you for more than 6 months. Okay, then you need to talk over cause or etiology of the disease. It is important to note that some diseases are caused by some pathogens, whilst other diseases come not necessarily because of pathogens, but because of some imbalances or inadequacy, as in the case of diabetes mellitus. Okay, then you have to move on and explain the system that is involved. When you talk of diabetes mellitus, we are looking, let's say if you talk about, let's say cerebrovascular accident, you find that the circulatory system, here we are talking of cerebral, okay, circulatory system is affected and the nervous system is also affected. When you're talking about diabetes mellitus, you're looking at the metabolic disorder here, of which the endocrine part is affected. Then you need to state the characteristic signs and symptoms distinctive of that condition. Okay, so here it is important that you give us at least 3, as this will help you to fetch a marks as you are explaining. So, in defining a condition, in summary, we are saying you should state the characteristic signs and symptoms and the causative organisms. The characteristics, signs and symptoms, and the causative organism. Okay, so now, just to amplify what I've just talked about in defining a condition, I'm just going to give brief definitions of some conditions here. Okay, so I have a question about the fracture. So the first question is define a fracture. So in defining a fracture, I'm going to say it is the discontinuity of a bone tissue that may come as a result of direct or indirect trauma manifested by loss of function, deformity, and severe pain. Okay, so within this definition, you can highlight some of the important elements that becomes distinctive of this definition. That is, when you're defining a fracture, okay, we are just necessarily looking at the discontinuity of a bone tissue. Okay, so that phrase there tries specifically to explain what a fracture is. Okay, then the cause, it's direct or indirect trauma. Okay, then what are some of the signs and symptoms that are characteristic within this condition? Is that there will be functionless, or there will be reduction in the function, there will be deformity, and severe pain may be followed. Okay, so another definition can be glomerulonephritis. Okay, so glomerulonephritis is the inflammation of the glomeruli that results in sudden appearance of blood in urine with clumps of red blood cells or casts and variable amounts of protein in urine. Okay, so that is how you define glomerulonephritis. Okay, so within all these definitions, I have tried to put in the elements there that have been retained in order to give a definition its proper distinction. Let me move on now to the other definition of cerebrovascular accident or stroke. This is the sudden disruption of oxygen supply to the nerve cells, generally caused by obstruction or rupture in one or more of the blood vessels that supply the brain. Then in defining diabetes mellitus, we are going to say it's a chronic disorder of carbohydrate metabolism characterized by hyperglycemia. Okay, so I've just tried to simplify the definition of diabetes mellitus here. It is important to note that diabetes mellitus is not only a metabolic disorder of carbohydrate, but also other food nutrients can be affected. And this is a condition mostly that affects the endocrine system because insulin that is important in regulating blood glucose is affected. It's either inefficient or inadequate, depending on the type of diabetes. Then let's try to define colostomy here. Colostomy is the formation of an artificial anus on the anterior abdomen wall by bringing a portion of the loop of the intestine to the surface of the abdomen as to provide an alternate route of excretion when the rectum is diseased. Okay, so that is the definition of colostomy. And then let's also define acute abdomen. Okay, so acute abdomen necessarily refers to conditions that have a sudden onset and affect the abdomen or abdominal organs and usually require immediate or urgent surgical intervention. Okay, so even if I've tried to put here surgical intervention, it is also important to know that there are also acute abdomen conditions that are medical in nature. Okay, then We can also try to define asthma here, okay, as a common chronic inflammatory condition of the airway, which is characterized by bronchospasm, severe dyspnea, wheezing, chest tightness, and expiratory exertion. Okay, so in all these, I'm trying to return the characteristics of the disease, the signs and symptoms, okay, and how the disease, the origin of the disease or the cause of the disease in all these definitions. Okay, so when you are trying to look at thyrotoxicosis, okay, you can say it's a disorder of the endocrine system that is caused by excessive thyroid hormone, thyroxine and triiodothyroxine in the blood, and it's characterized by increased body metabolic rate. Okay, so then the other definition I'll try to look at here is measles, which is an acute highly contagious viral infection, also known as rubella, caused by a virus known as rubella virus, characterized by body rash, fever, and red eyes. Okay, so then maybe the last definition here that we would try to look out here, so that you can at least get how we define diseases, is hookworm. Okay, so when you're trying to define hookworm, you can say it's a disease, okay, or hookworm is a disease of a nematode that is caused by infestation with either ankylostoma duodenale or Necata americanus. So infestation with hookworm is known as ankylostomiasis. Okay, so ankylostomiasis is a nematode. Okay, so it's a worm infection. So it's a nematode disease that is caused by infestation with either ankylostoma duodenale or Necata americanus. Okay, so these are some of the things that you need to put in mind when trying to define a disease. Okay, so it's a characteristic of the disease, signs and symptoms, and causative organism. You need to state, okay, if at all possible, within that you state whether the disease is acute or chronic. Okay, explain the cause. If there is a causative organism, it's important you even mention the causative organism. Then also it is important you mention the system that is involved and also the signs and symptoms, okay, that are characteristic of that disease. Okay, so that is how you define a disease. Okay, whatever the disease is, whether it's in medicine, surgery, mental health, and the likes, please, it's important that you follow this format because there are certain elements that should be retained for you to give a proper definition of a disease. Okay, so now with that discussed, let us look at medical management. So when they say medical management, they are just saying investigation plus treatment. What will be the investigation plus treatment, and then the nursing care? So when you're writing medical management, you need to include these parts, which is investigation and treatment, then the nursing care. Okay, so this terminology, medical management, okay, sometimes or most of the time it will come in a question where they ask you, what will be the medical management of this condition? So they are simply just saying, include the investigations that will be done, of course, as advised by the doctor, and then the treatment also as advised by the doctor. So now when writing investigation, what are some of the elements that you need to look at on how investigations are done? Okay, so here you can try to use the mnemonic HP, okay, compass, that is computer, that is comp, then lab. So HP comp lab, okay, so that is the mnemonic for you to remember investigation, regardless whether the condition is in mental health, whether the condition is in reproductive health, or it is in surgery or medicine. So you can use this mnemonic and lay out your work. And the simple reason as to why I'm even teaching all these parts, because in mostly students will fail because of lack of proper layout. Mostly even doctors and nurses who are screening patients, they will write notes about the patient, but if there's no proper layout, it's very difficult to analyze their work as to how they are arriving at the diagnosis. So important that documentation is very, very important. So there should be a good layout of the notes until you reach the diagnosis. So that helps us to understand that yes, there was some kind of procedure that was followed. So these elements of HP Comp Lab can be used as a mnemonic for investigations to be done. So H is for history. Okay, in as much as other computerized investigations are important, it is important to know that within history we can get characteristic signs and symptoms of the disease and be able to come up with a diagnosis even before computerized investigations are done. Okay, so computerized investigations are done necessarily for confirmation purposes. So H is for history. Okay, at least two areas. Okay, the environment, signs and symptoms, the medical history, okay, pharmacological history, familial or demographic, or other perpetuating factors to the disease. So these areas need to be noted within the history. So whenever you're taking history, okay, look at those areas of environment, signs and symptoms, okay, medical history, pharmacological history of drugs that they might have taken before, and before that is they come into the hospital, or that they might be taking, okay, then whether the disease has been running in family depending on the condition that you're looking at, and also the demography, okay, and you also look at the perpetuating factors to the attack or that which brings the condition to exacerbate. So that is within the history. So history forms a very, very important investigation in any medical examination. Okay, so it should never be ignored. So there's no condition which is too big that you cannot get history. So this is very important as one of the basic investigation in any condition. All right, then in the HP Comp Lab, then P is for physical examination. So in physical examination, you do inspection, percussion, palpation, and auscultation. Okay, so this one, it is a mnemonic also as IPPA, IPA. So that is within the physical investigation. So in this physical investigation, you need to know that in inspection, you are using the sense of sight in order to come up with a diagnosis. Of course, this is a sense of sight that has been enhanced by scientific knowledge, by you analyzing to come up with the condition. Then there's the percussion, palpation, and auscultation. Okay, so all these senses here, when you talk of percussion and palpation and then auscultation, okay, there are specific senses that you're trying to use, okay, that has been enhanced by your scientific knowledge. Okay, just like when I talk of palpation, sense of touch, there you are able to come up with a diagnosis just by trying to hold some kind of growth or abdomen. You're able to tell information that is deeper than just touching the skin. You're able to tell certain things that are underlying some kind of growth, or just doing some palpation. Even by percussion, you get different sounds. You'll be able to, where you're using the sense of hearing, and be able to judge why the certain sound will be heard. So that is that. Then auscultation, you're going to use the sense of hearing enhanced by a stethoscope. Okay, so as you are making a diagnosis. So then in the HP Comp is for computerized investigations. Okay, so here we're just looking at all investigations, that are enhanced by computer, and that includes computed tomography scan, okay, magnetic resonance imaging, ultrasound, X-ray. All these are computerized investigations. Please, when I'm talking about computerized investigation, in certain conditions, this might not be necessary Okay, but it also depends in the area you are and how advanced you might be. Okay, so in the area where I might be, certain investigations like just ordinary malaria without any severe signs and symptoms, it might not require you to do any of these advanced investigations. Okay, then laboratory investigation, that is for lab. So the laboratory investigation, here you do full blood count, you do cross match, you do blood slide, blood culture. You also do biopsies like cytology and histology. Okay, and also you can do hematological studies. Okay, and try to find out any abnormal things within the patient's samples. So laboratory investigation is simply for full blood count, blood cross match. So these are what we call laboratory investigation. So in the investigation, you just follow the HP Comp Lab, okay, as a mnemonic on how you're going to lay out your notes, okay, how you're going to lay out your investigations. So you start with history, physical examination, and a computerized investigation necessary for that condition, and then we also do a lab investigation that includes a full blood count, cross match, a blood slide, and the likes. Okay, so now that takes us to treatment. Okay, so treatment mostly you're looking at drugs. Okay, so here you state the name, dose, route, okay, frequency, and at least 2 side effects with the precaution. So whenever you quote a drug, follow the mnemonic NES. Okay, so NES, the proper spelling of NURSE. Okay, so whenever you quote a drug, okay, in the treatment, we are saying it is important to write the name of the drug and also, if possible, includes the group of the drug where it is coming from. So the name of the drug can just be the name of that drug or the group the drug is coming from and then the name of the drug. So you can try to combine those two. Then U is for use of the drug. Okay, so remember we have the use of drugs like antibiotics for bacterial infection, analgesia for pain, and pyretics for fever. Okay, so those can be used. Then the other most important part in our nursing pharmacology is the responsibility of a nurse. So R is for responsibility of a nurse. So the responsibility of a nurse center around the precautions that are supposed to be taken when you give a drug. So you are not just giving a drug, but you need to observe certain precautions so that the patient may not suffer severe allergies, or patient will understand how the drug is working in case they see certain side effects, okay, that may come, and this so that they will not suspect that it is another disease when actually it is the side effect of the drug. So R is for responsibility of a nurse, which centers around educating the patient about side effects and what to note. Then S is for side effects. It's important you also note some side effects as you are writing about a drug profile. So write about the side effects of those. So please, it should not just be nausea and vomiting. It is important to know some of side effects that are peculiar to that drug other than nausea and vomiting. Okay, so then education. E is for education. So each drug that you give the patient, you need to educate them about that drug. Okay, for their conditions as like you cannot take beer when you're on this drug. So such is very, very important. So educate the patient about the drug so that when they notice certain side effects, they will understand that actually it is because of the drug that they are taking. So when you're writing the treatment, mostly you are looking at the antibiotic for that disease, anti-cancer drug that is needed within that drug, within that disease. So we are looking at antibiotic for that disease. Okay, then we're also looking at other if it is cancer, that is anti-cancer of that disease. Okay, so that is what you look at. And then what is follows next is analgesia. When you're writing about drugs, what follows mostly, it's analgesia, because pain is a common symptom that brings a patient to the hospital. So there might be need of analgesia. So now analgesia contain antipyretic part. Okay, so then there are also what we call supplementary drugs, because of a certain side effect that may come from the drug, or because certain symptoms that the patient may have. There are supplementary drugs that you can give to stop vomiting, or vitamins. Okay, so when you are trying to treat a disease, look at some of the classes of drugs that should be there, or that you can put. In certain diseases, there are combination of antibiotics that you need to put. So, like when you're talking of peptic ulcers, okay, look at the combination of the drugs that you need to put there before you give the other drugs for reducing acidity and the likes, and also reducing the secretion. Okay, so it is important whenever you are quoting the drugs, but what you need to know is we want to look for that and the drug that is going to work against that disease. So we are saying the anti, it can be antibiotic, anti-cancer, and whatever. So what is it that is going to work against that part? If there is increased production of, let's say, thyroxine hormones there. So which drug is going to work which drug is going to work against that? So you mention that, other than just mentioning antibiotics, analgesia, and vitamins. So look at the specific drugs that is going to work against that disease. Okay, so that is on treatment, and when you're writing the profile, follow the mnemonic NES, that is the name of the drug, the use of the drug, R for responsibility of the NES, that is in taking care of the precautions that couples the drug, then the side effect, and also the education concerning how the drug should be taken. Alright, so then when we come to nursing management, okay, so here the nursing management, now here we mean when you come now to the nursing care. Okay, so then in nursing care, the aprophenema is for the nursing care, mostly in medicine. Okay, so aprophenema is mostly nursing care in medicine. What is important to know about the aprophenema is that this is just simply a guide. Okay, it's a guide that gives us elements that we need to look at when we are caring for our clients. So in the aprophenema, we have A for M. So whenever we are caring for our patients, we need to draw up some objectives. Okay, so in our objectives, it is important to note that some of the objectives of our nursing, whenever we are nursing a patient, okay, is to prevent. Okay, so what are you trying to prevent? You're trying to prevent complications. Okay, so some of our aims include restorative. Okay, some of our aims include supportive. Some of our aims may be promotive. Some of our aims is to alleviate. Okay, so those form mostly part of our nursing goals. So in our aims we say to prevent, in our aims we say to promote, okay, to alleviate. Okay, so once you familiarize yourself with those within fundamentals of nursing, then it becomes very easy, okay, to write your aims. So the aims, you just need to have two, okay, and you don't need to nearly write necessarily a paragraph, but otherwise, if you are in the mood of writing a lot there, you can write 4, but otherwise, for the purpose of examination, you can just write just 2 aims, those will be enough. Okay, so then P. Okay, so we have 2 letter P's within the aprophenema. So the first P, I'm just giving it a position. So position is very important in the restorative, practice of nursing, especially in surgery. So position may play a big role, okay, in trying to modify the patient's environment or body in trying to bring about restoration. Okay, then R is for rest. So rest is also very, very important, as it helps to improve brain function, okay, because when the brain rests, it becomes very active. It reduces, there will be stress that will be reduced, and also rest improves immunity, as the body now responds faster to any invading organism. So rest is very, very important as a parameter in our nursing management. Then all is for observation. All right, so now on observation, mostly people try just to talk about temperature, pulse, respiration, and blood pressure. Okay, so when you're looking at a surgical patient, there is a lot mostly that you can observe. When you're looking at a patient with reproductive health condition, there's a lot that you can include in the observation, and we have a lot of observation charts that we can use. Okay, so even observing for issue of opening bowels is also very important, okay, and becomes sometimes specific if at all patient had a condition that may also bring constipation as a problem. Okay, so opening of, let's say, the urine that patient is passing also becomes very important, especially if you're looking at a condition that may affect urine output, like a renal condition. Okay, so when you're looking at observation, there are a lot of observation charts that are there. There are fluids that you also need to observe, that they are running very well. Okay, if at all there are any drainages, okay, it becomes very important so that you observe. So here it is not, here you don't have to restrict yourself so much to observing temperature, pulse, and respiration, and BP. In as much as they are important, also, it is important that specific to the condition, look at other areas that you can simply make a good observation. Then psychological care, mostly psychological care is about explaining the disease process to the patient, also allowing the patient to have some visitors that are going to offer emotional support. Okay, so psychological care also involves making or allowing the patient to have enough rest by doing the procedure in packs, so that you don't disturb the patient all the time. So that is to do with the psychological care. So if you have to be good at nursing management, it's important that you know in each and every part of these elements what you need necessarily to do and other interventions that are there. Okay, then hygiene mostly is for hair care, it's for nail care, okay, it's for patient to bath, okay, and those are some of the many areas of hygiene and oral health. So those are very, very important to mention. It doesn't matter the disease that the patient is having, okay, patient needs to have a proper hygiene, apart from shaving, which becomes so specific when you're talking of surgery, depending on the surgeon's preference. Okay, then we move on to understand exercises. Exercises, is when you talk of surgical patients, they help to retain the range of motion, and exercises improve immunity. When you're talking of hypertension, it can also help in regulating blood pressure. Okay, it becomes a prescription for improving health, that is exercises. Okay, so exercises play a very important role, but it is important also to know in which disease you are going to make a lot of emphasis when you're talking about exercises and when the patient can necessarily do those exercises. So exercises can be passive and can be active. When you say passive, those are assisted exercises. Then when we say active, those are exercises that the patient can do on his or her own. All right, then nutrition. When we talk of nutrition, here we are just talking about necessarily those nutrients that are going to help in the repair of the body. Okay, apart from the nutrients that will help in the repair of the body, also we want the patient to heal fast from the disease, so you make those emphasis. But when you're talking of an emergency in surgery, sometimes this part of nutrition may mean to put a nasogastric tube in order to prevent aspiration during surgery. So that is to do with nutrition. So depending on the condition, there are certain emphasis that you need to put in. So this does not necessarily need for you to just master to say, oh, this is ABC. So the emphasis diagnosis should be necessarily according to the disease. Then E is environment. Okay, so environment needs to be manipulated to help improve the patient's well-being. So in the environment includes improving air circulation, making available all the things that the patient may need in case of change the condition, and also to maintain good health. So certain things may include suction machine, oxygen that might be needed, okay, the providing of the pillow to the patient, opening nearby windows, also ensuring that there is no noise within the environment, and all the measures that you can do, okay, to help improve the environment. Okay, so this one mostly comes as a first heading for most of the essays, okay, for a lot of practicing student nurses. So it becomes one of the main heading that they try to, but it's important to know how the information should flow in your manipulating of the environment. If you're talking of mental health, the environment, it depends, if the patient is manic or is a little bit depressed. So how do you manipulate the environment so that the patient does not take his or her life? Okay, so that the patient environment, it becomes therapeutic. So those points become very important. Then aim in their prophenema is for medicine or pharmacological drugs that you're going to give. Okay, so please here it's important that drugs are given through the right route, okay, at the right time and the right patient, and observe all those rights. Then aim is for advice. Okay, A is for advice. So, or here on advice, you give what we call information, education, and communication. Okay, so that is the thing there. So that is on the A, advice. So you give what we call information, education, and communication. Okay, so on the aims, I've said at least two, and they should be specific to the condition. Okay, and like giving general aims, okay, within their prophenema. Then the two specific nursing care headlines with more than 5 points on each headlines. When you're writing on a certain condition, ensure that you come up with 2 or 5 main specific headings for that disease, so that you write the interventions within that. Then 3 or more non-specific care headlines with more than 5 points on each you can write. Okay, so you are not going to write the whole prophenema there, but you can look for the other 3 that you feel within this condition can fit. Okay, then on advice, that is the information, education, and communication. Okay, mostly the questions they will ask you for at least 5 points. Okay, and here you can mention 2 that are specific or 3 that are specific. Okay, so the mnemonic that we use mostly for information, education, and communication is Dr. PHN, that is DRPHN. Okay, so D is for drugs. So on drugs, there we want patient to be drug compliant. So on drugs, you ensure that the patient takes a drug and educate the patient on the drugs. Okay, so that the patient has all the supply of drugs that they need. So that is a D for drugs. Then mostly a patient with a chronic condition or a condition that was critical and was discharged, most of the time they will need a review. So this review is important for monitoring the progress of the condition, and also to know whether the patient is improving or not. So it just becomes a follow-up before patient is fully discharged. Okay, so R is for review date. So, and I've explained what the review, or why the review date is important. Then P is for prevention. You necessarily don't want the patient to come with the same condition over and over. So prevention, they say, is better than cure. So you teach the patient about how they can prevent an attack or further attack of the condition in future. So that is a P for prevention. Then H is for hygiene. Okay, so cleanliness is good next to godliness. Here what I'm trying to say is a cleanliness also chases away a lot of diseases. So Proper hygiene is something which is very important that you can teach the patient on, that is in IEC, Information, Education and Communication, because with good hygiene, a lot of diseases are prevented. Then nutrition. Okay, to prevent malnourishment of any kind, the patient needs to be educated about proper nutrition. Okay, so this is very, very important also for drugs to effectively work. You need to teach the patient about nutrition. Okay, then the other part, if they do not ask you necessarily on the last part, they don't ask you about IEC, they may ask you about complications, and complications mostly possibly 5 that they will ask you. So when they ask you about complication, explain those specific 3-5 complications, and then you can put in other general complications that may be related to the disease. Okay, or you can just write all the specific complications that are there within the disease. Okay, then the other part mostly which comes as part B in the questions in the exams is the pathophysiology. Okay, so I've already done a video on how to write the pathophysiology, but in this lesson I'll try just to emphasize the importance of the disease cycle in writing your pathophysiology. Mostly, students find it tricky to write the pathophysiology because of not knowing which element should come when, okay, and which one should come next when they're writing the pathophysiology. So if you master the disease cycle, it becomes very easy to write the pathophysiology of any disease. So in the disease life cycle, we have the first part, which is the characteristic of the organism or the pathogen. Okay, so here we're necessarily looking at the type, whether it's a virus, bacteria, or fungi or parasites. Then we are also looking at the ability of that pathogen to invade the host. We are looking at the virulence or the degree of pathogenicity, and we are also looking at the degree to which it may cause the disease and number of organisms that may be responsible of that disease. So when you're writing about pathophysiology, here I'm saying it's important to know the origin of the disease or etiology of the disease, what it will necessarily cause. So you can mention the pathogen there. Then the other part that becomes very important is transmission. So in transmission, there you talk of port of entry. Okay, so some of the main port of entries of diseases may be eyes, it may be mucous membrane, it may be the respiratory tract, it may be the placenta, or maybe even a break in the host skin barrier. Okay, so those can be some of the port of entry. So when you explain the pathophysiology, you can talk of transmission and necessarily emphasize on the port of entry. Okay, then the other part, as you explain the pathophysiology, can be the reservoir of the condition, the reservoir of which can be humans, and those diseases that can be transmitted from animals to humans through what we call zoonosis, you can still mention. And then also how the environment can play as a factor in transmission of the disease, of which we may have food being a reservoir when you're talking of diarrheal diseases, flies being also the reservoirs or transmitting vectors of the disease. Okay, then after you talk of the reservoirs of the condition, then you move on to talk about port of exit. Port of exit, some of the things that you can try to make emphasis on is the respiratory tract, okay, the genitourinary tract, gastrointestinal tract, the skin or mucosal surfaces, placenta or blood. So you might notice a similarity of port of exit and the port of entry there for the disease. Okay, then mode of transmission. Please, the available mode of transmission of a lot of diseases that are unknown may include direct contact, droplet, vectors, or airborne. Okay, so talking of mode of transmission within the disease cycle or within your pathophysiology can give a lot of depth in your pathophysiology. Then the next part that you should follow is the characteristics of the host. Okay, characteristics of the host. So what may cause increased susceptibility within the host so that the disease can now show? Okay, it can be lack of effective resistance or changes in the host defenses or necessarily tissue destruction. All right, so these are some of the things that you can try to look at when you are explaining the pathophysiology. So have the disease life cycle in mind so that you can lay out your point systematically. Okay, so then this takes me to another part which is rehabilitation. Okay, so rehabilitation can be another point that they may ask you in part D of questionnaire. So rehabilitation here, mostly I try to teach my student to use the mnemonic DR speech or Dr. speech. Okay, so there are conditions in which rehabilitation may entail, for drug abusers, there you may include drugs itself. Okay, for drug abusers and adherence, so that the patient may have lesser signs of those addictions. So in rehabilitation, drug part here becomes very important. Of course, it depends also on the condition that you are writing, where you might need to emphasize the issue of drugs. As I have given an example of mental illness. Then R is review, okay, for the disease. So review is very important in the rehabilitation to monitor the progress of the patient. So apart from review in the rehabilitation of the patient, you can use resocialization. So resocialization here means instead of the patient going to socialize with the people that also might be the cause or might have played a role in worsening the condition, you might need to resocialize the patient with people that are going to help with the therapy, okay, so that the disease is cured or the condition may be cured. Then S is for skill. In the rehabilitation, skill reorientation or learning of survival life skill is very, very important, because after a certain illness, it may be very difficult to return to the normal job. So in rehabilitation, there might be some work adjustments that are needed. So skill reorientation or patient being taught survival life skills might be the next in line. Okay, then S or P is for psychotherapy. Okay, so in rehabilitation, it is important that sometimes certain things can be dealt with psychologically or through counseling. So that's why we are talking of psychotherapy. So apart from that, psychotherapy may also help in prevention of further attack or worsening of the condition. So in rehabilitation, we talk of P for prevention. Okay, so that prevention of attacks in future. So that is P for prevention. Then when you're talking of psychotherapy, it also helps in behavior modification. Okay, so psychotherapy, we are saying it may also help in behavior modification. So when you're talking of P, also have in mind to do with behavior modification in trying to improve the patient to cope up with the new ways of doing things because of the sequel of the disease that they might have been affected with. So the first E in the rehabilitation of the patient can be education. So since we have talked about skill reorientation, it is also important to educate the patient for new skill and about the disease, so that they can improve on their health, or they can be part of and parcel of everything that is being done to improve their condition. So E is for educating the patient, okay, that is educating for new skill and about the disease. Okay, so the next E is environment modification. Okay, so environment modification, sometimes, especially when you're talking of issues of mental health, you return to the same environment, the disease keep on coming. So environmental modification may be physical, may be psychosocial, or maybe psychological, or maybe social. So these, they also need to be manipulated in order to help the patient to heal. Okay, then C is for counseling. Counseling is therapy. Okay, because in counseling you use communication as therapy in trying to help the patient. So counseling is very, very important. Okay, so then in answering, then H is for hygiene. Hygiene helps in the rehabilitation because improved well-being about self can help the patient to have a good concept about self. So hygiene is important in also preventing a lot of diseases. So there you have it. Today we were looking at ways in which you can tackle essays within medical conditions that you might be learning. Okay, and we have just talked about the different parts. Okay, and we started looking at the definition part where we gave different examples of definitions, and then we have talked about medical management, of which we have emphasized that when they say what will be your medical management, it means before you write your nursing care, which is their prophenema, you talk of investigation and treatment. And on top of this investigation and treatment, you don't write your aims there, no, because the aims there, they are for the doctor. He's the one who's going to order the investigation. So he's the one who draws up those aims or objectives for doing those investigations or for coming up with a certain treatment. Your job is to write your aims to do with your nursing care, or to write your objectives in concerning nursing care. All right, so when you are writing your nursing care, we have talked about the elements of a prophenema that you can write, and then when you're writing IEC, we have talked about the element mnemonic, which is a DRPHN or Dr. PHN. And when writing pathophysiology, we have emphasized that the importance of knowing the disease life cycle, so that we can have a pathophysiology that is flowing well. Okay, because this is where a lot of challenges come, not knowing the disease cycle. Okay, because the pathophysiology entails you should know how the cycle of the disease moves from the causative organism, transmission, okay, mode of transmission, and the characteristics of the causative organism. Then the last part here, we have just talked about rehabilitation, where we have mentioned doctor's speech, which involves drugs for drug abusers, as an example, ensure adherence so that they do not go back to their addiction. Then a review, okay. In rehabilitation, we have noted that review is important for monitoring patient's progress, and then R can be for resocialization, which helps the patient to be with the new members that can help in the therapy. Then ACE is for skill reorientation, because patient needs to have new survival life skills. Okay, then P is for psychotherapy, prevention, or behavior modification. Then E is for education, for new skill and about the disease. Then E is for environment, and the environment can be both physical or psychosocial. Then C for counseling, and then H for hygiene. Okay, so that is what we're looking at, and I can encourage you that when you go through this, you